it was only the children who had not been vaccinated, because it was said that the illness is milder in children. Most of them are asymptomatic. Between the ages of 15 to 18, they are more exposed to other adults compared to younger children below 10 years of age who are more confined. So that is why it's a good decision, and we'll be starting to immunize them from 15 to 18 years onwards from Jan. Covaxin is a whole viron vaccine, okay? Some are not the whole viron vaccine. So Covaxin will be more useful for more variants also.
Hi guys, this is Meena Devan and you're watching HealthSiteAndIndia.com, and today we have with us Dr. Farah Ingale, Director, Internal Medicine, Fortis Hiranandani Hospital. Hi doctor, how are you?
Hi, good morning. I'm good.
Doctor, with regards to children, now that the vaccination process has started in that age group as well, what are the guidelines with regards to the doses for children?
Yeah, so now government has approved for the vaccination, that is Covaxin, which is an indigenously made Bharat Biotech vaccine, and it has been approved again as an emergency use authorization vaccine for the ages of 15 to 18 years, because it is at this time which has been studied both locally as well as the global data, which says that mortality because of COVID in children in this age group is maximum. 75% of mortality is between the ages of 15 to 18 years. There are other vaccines still not approved by our government, but can get approval. Like if you see the Zydus Cadila vaccine, that is ZyCoV-D, which is a DNA vaccine, which is for use for children from 12 years onwards. But as of now, we have this Covaxin between 15 to 18 years of age, which has been approved, and the vaccination is soon going to start, which is a good news. Because actually what has been seen is now about in India, Maharashtra, we have about 61% of patients who have received both the doses of vaccine, either Covishield or Covaxin. All the adults are mostly going for vaccination. It was only the children who had not been vaccinated, because it was said that the illness is milder in children. Most of them are asymptomatic. But these children are the ones who can spread infection to elderly people at home or in society. So, and then between the ages of 15 to 18, they are more exposed to other adults compared to younger children below 10 years of age who are more confined. So that is why it's a good decision, and we'll be starting to immunize them from 15 to 18 years onwards from Jan next year.
But doctor, why just Covaxin?
That's what I'm saying, because Covaxin has been approved, but now we may have the DNA vaccine also, which will be approved for use in children above 12 years of age.
What I particularly...
Covaxin is a whole viron vaccine, okay? Some are not the whole viron vaccine. So Covaxin will be more useful for more variants also. So that's a better vaccine, they say. Because if you see, there are vector vaccines, there are messenger RNA. Messenger RNA vaccine is not available in our country because of other technical logistic issues. You have to store that at minus 70 degrees centigrade. So Moderna is also same. Both of them are not available in our country. Covishield have been shown, though very rare, but some side effects also. And it's not a whole viron vaccine. It's a vector-based vaccine. So whole viron vaccine is better for even mutants. So that is why they've chosen. And it is an indigenous vaccine. So that is why that has been approved. But then the DNA vaccine may also be approved soon. So that can also be given to children above 12 years of age.
But that doesn't hold true in case of adults. Isn't the, going by the same logic, isn't it better for adults as well?
For which vaccine you're talking about?
Vaccine.
Covaxin has been used in adults also, but initially when we as healthcare workers had been vaccinated, we had no choice, because that time Covishield was available at our place. So we did not have choice in the beginning. And now the criteria that the government has fixed is the booster dose has to be of the same vaccine for the first two doses which you have taken. Like if you have taken Covishield, the booster will also have to be of Covishield. If you have taken Covaxin, booster will also have to be of Covaxin. Of course, in CMC Vellore, they are doing the research whether mix and match of the vaccine will be better, whether it will give you better results and better protection. But once it comes out, till then, government has made it that it has to be the same vaccine. So initially we did not have choice. like Covaxin was available for use only at state government hospitals. In the corporation hospitals, we had Covishield, so we took Covishield. So now, as a booster, we will have to take Covishield. Okay, that
Doctor,
is the guidelines.
but in that case, doctor, now that we have narrowed down in a year और अब हमारे पास और भी ज़्यादा data है, अगर आज आपसे ये सवाल पूछा जाए that is Covaxin better than Covishield, what will be your answer in general?
No, that's what I'm saying. See, both are equally good. Not against the variants. We don't know against the variants, because what we think is Covaxin will be better against the mutants, against the variants, because it's a whole viron vaccine. But Covishield also has been effective, at least for Delta. Okay. So we don't know. Against Omicron, they say that it may evade. Okay. But we are still not very sure. See, it's a new virus. It has affected mankind only since December, 2 years. It's not even 2 years. It's 18 months that we have come to know about the vaccine. So everything is new for us and researches are on. So exactly we cannot say. It may still take time for us to prove that this is the best, which is not good, which is the best. But Covishield is also effective. We have so many, in fact, more people have received Covishield than Covaxin all over the world. And they have had good protection, about 60 to 70% protection. But then because the variants are coming in, it is difficult to predict further. Okay.
Doc, also, senior doctors and a lot of public health officials also made a statement that this decision of, starting the vaccination process for children is majorly due to political consideration, and there is barely any scientific, evidence of favoring this process to boost for children of this age group, 15 to 18. Is it true? There is no
I
such...
don't think so. No. Because see, even children have been reported to be positive. Even deaths have occurred in children, and adults have already been immunized. Why to leave children alone and let them suffer? I don't think it is politically motivated. I don't agree. Everyone should get immunization done, because these are the people, children are the section who transmit infection to adults even if they don't suffer themselves. Most of them, as I've said, are asymptomatic, but they are a source of transmitting the infection. If any elderly person is exposed to those positive children and they have comorbidities, they can suffer a serious infection and even die. So everyone in the society, whoever are eligible, should be vaccinated.
As per a lot of health experts, there are no such evidence which proves that it will work for children as well, because the experiments haven't been
It's too early to
conducted.
say. It's too early to say that. Like, I have the pediatrician friends. I'm a physician and diabetologist, but I'm seeing COVID patients right from day one when it has come here. But then, as per my pediatrician friends, they also feel that all the children should also be, who are eligible, should be vaccinated, immunized. So I don't think, again, it's always better, no? Why not?
And precautionary doses for 60 and above is also in line now.
Yeah, so it has been approved now. After healthcare workers, it will be the elderly people with 60 plus and with comorbidities who would be given the booster dose now.
Yes. So that
has already been approved.
Yes. So any other precautionary measures or anything that people should keep in mind from their end, apart from getting their booster doses?
So it's not only the booster which will give you foolproof protection, as I'm repeatedly saying. You still have to continue with COVID appropriate behavior. You have to still wear your mask properly, not properly. It's not just hanging below the chin or not covering your nose, because the portal of entry of virus is from the eyes, from the nose, and from the mouth. Okay, so you can use a 0 number goggle if you don't have specs. Specs will give you natural protection, or you can use a shield. You'll have to wear a mask, preferably N95 mask for the healthcare workers or for the frontline workers. For other people, surgical mask, triple layer is sufficient, but it has to be worn properly, covering the bridge of your nose, below the chin, from the sides. It has to be packed, okay? And then 6 feet distance. You try to maintain that social distance of 6 feet. Use sanitizers properly. Whenever you are exposed, you use a sanitizer. That has to continue. That is like mask itself is like a vaccine. It acts like a vaccine. You have to still follow COVID appropriate behavior till all the cases from the world gets away. We do away with, there are no cases reported from the world. You have to continue using this COVID appropriate behavior.
And anything different for the children, now that even children vaccination process will soon begin? Anything different for the children that children should keep in mind?
No, children, it is difficult for them to follow. Somebody will have to supervise. The parents will have to supervise. If they're going to the school, the teachers will have to supervise. The guardians will have to supervise. And rest is like, you should maintain your general health, your nutritional status. You have to look into to maintain your immunity, because as your immunity falls, you catch up more infections. So you should have good nutrition. You can have high protein diet. You may take antioxidants. You can take vitamins to boost up your immunity. And then secondly, of course, COVID appropriate behavior for children as well, and vaccination. Everything goes hand in hand. Everything needs to be followed, even for children.
I think, Doctor, this was pretty insightful. Thank you so much for joining us today. Audiences will go back home with lots of valuable insights. So thank you.
Thank you so much. My pleasure coming here. Thank you so much.
Thank you.